Welcome back, everyone, to Cocktail con las Chicas. This is Dr. Marisol Brescia.
This is Carmen Kishaf.
Hope everyone's doing well today. Carmen, how you doing today?
I'm doing very good today. Today was an
Excellent.
okay day.
Okay. Seems like you're still dressed up just like me, getting home
Yes,
late.
that's right.
Okay. So today, our new episode is about entrepreneurship, right? How we started our practice, all the steps as a nurse practitioner. I'm personally in the world of psychiatry, and Carmen, you're in what world?
Multiple, but I am doing primary care. I'm helping out with a little bit of nephrology medicine. And also, I want to start a business on IV therapy, hormone therapy, and weight loss.
So you got a lot of options right there.
Yes.
So you are what kind of nurse practitioner? So everyone,
I am an adult gerontology nurse practitioner.
okay. And clearly with that adult gerontology route, you're able to kind of do a little bit of this, a little bit of that.
Yes, I can do
Right?
a little bit of cardio, a little bit of whichever specialty I want to go. I just have to get trained and then I can work there.
Perfect. And that's the beauty, right? Of
Yes.
that being in the nursing world, now moving up towards a nurse practitioner, now moving up into having our own practice, you're able to have that flexibility.
And options.
Options. Let me ask you this, Carmen. Why do you think that you were so driven to open up your own practice? Like, why do that? Why not work for a hospital? Why not work in conjunction with private practice?
For me, is because of the scheduling. Like, I feel like if I have my own business, I can absolutely control my schedule the way I want to.
That's true.
Because I'm so busy with my kids that I want to make sure that I am there as a mom for my kids. Plus, I can also fulfill my dream of being a nurse practitioner. So that is number one reason. It is hard to own your own business, but I think it gives you a little bit of freedom.
Absolutely. I was just going to say that financial freedom,
Yes.
freedom in general for flexibility, like you said about scheduling, right?
Yes.
And then, like in your world, you're able to do a little bit of everything.
Yes.
You're doing a little bit of cardiac, a little bit of nephrology. And I know that you have the background as well as being involved with your own family, right?
Yes.
Are you working with your family?
Yes, I'm working with my family currently. And
Perfect.
I'm gonna also start doing like a little bit of dialysis, like going to dialysis center. Is 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 very interesting.
And you've mentioned before, your in-laws are both physicians. Your husband
Yes.
is obviously a nephrologist.
Yes.
Mother-in-law is nephrologist and father-in-law is cardiologist.
Yes.
So you're surrounded by professionals, support, right? If you
Definitely.
have any questions, any backup
Yes.
that you need, you have the right resources.
Yes. Yes,
That's
definitely.
that's phenomenal.
It is
So
phenomenal, yes.
on my ends, my husband is a pulmonologist, was an intensivist. In my world, doesn't really pertain, right? Because I'm in the psychiatric world. I've
Yes.
asked him questions in the past, and although he's a brilliant person, he even says it, honey, this is a whole different animal
It's
for me. This
it's
is a whole
totally
different
different.
language,
Totally
right?
different.
So even with working with other physicians, residents, psychiatric nurse practitioners, it's really specialized. It's really psychiatric, right?
Yes. It's another
So
word for us.
it's another world. Exactly right. Do I have the support, the emotional support that I need? Absolutely. That part he provides. But as far as knowledge, remember, even primary physicians, they may start psychotropic medication and then they refer out because
Of course.
that is not their world,
No,
right?
not at all.
So a primary
I have
physician,
not prescribed the first medication.
okay,
I have not yet
for psychiatry. So
for
you don't feel
psychiatry.
comfortable even like Alexapro or something like Zoloft, like something basic, simple, and then refer?
Not yet. I don't feel comfortable yet with psych medications.
Okay.
I prefer to refer them because I think
There's
like
nothing
that's
wrong with
not my
that.
expertise. I just gonna help send you to the person that can help you the most.
And you know what? I think you mentioned a really good point because I think as we move on or trying to talk to people to inspire them to actually go and open up their own practice, a lot of them are not comfortable. However, you are vocalizing your limitations, right? That's extremely important. You know what? I'm not really comfortable with that, but I know how to find someone else.
Yes.
I may know people, right? You connect, you network with other people for that reason, so that in case you have to refer,
Definitely.
You're already connected,
Yes. And you can
right?
find the resources for that patient. You just don't leave the
Absolutely.
patient hanging. You say, listen, I'm gonna find the help that you need.
1000%. 1000%. But let's start from the beginning, right? The dream. My dream was always to be a boss. Not
Boss
because
lady.
a boss babe, right? That boss woman, that role model, someone that my son, that my family can look up to, someone
Mhm.
that I want my husband to be proud of, to be with. That didn't mean I
Exactly.
had to be a boss in order to get all their respect. But for me, self actualization was to be on top of that pyramid for me, right? So I always wanted to be a boss. Now that comes with work, as you
A
know.
lot of work. A lot of work.
That comes with work. A lot of people say, oh, but you got your business, you're good. But
Oh,
expenses, the
it's
expenses, right? First of all, the fear. Were you scared at all, Carmen?
I
Was
was
there any
scared to death.
hesitation?
I was scared to death. I have not even opened yet and I'm still scared. It is so scary. But I think we have to just do it. I think remember we both were in the same path
Yeah,
and you one day decided I'm just gonna do it today.
just do it.
And you went and you did your LLC and I've
Yeah,
been asking you questions ever since and then like
yeah,
it took me like 4 months after you did your
that's
LLC to
okay.
finalize my LLC.
It's better late than never. And
That's
like
right.
you mentioned, just do it because are we really prepared? Do we have a manual that says exactly what to do? No. It's almost like having a child. Are you born knowing how to be a parent? No.
That's
You
right.
kind of learn as you go. Same thing with private practice, right? If that's something that you're looking into as a goal, you just got to jump in.
Components, so many components.
1000%.
Like I didn't realize it was so much work because I don't know in social media because I've been doing a lot of research on Facebook. I follow a lot of groups that they do IV star group, like for example, psychiatric practice star groups. They have like so many groups, and I think sometimes people underestimate the amount of work and research that you have to do in order for you to, from the vision to the opening, it can take, it's a long time unless if you hire somebody that can do everything for you. You have to do, if you're going to do everything yourself, it's going to take you sometimes because on top of
Absolutely.
it you are working, on top of it you are being
Definitely.
a mom, on top of it you are doing all the responsibilities that you cannot concentrate 100% on opening a business.
Well, first of all, you got to be organized, right?
Very organized.
Organization is going to be key. Why? For the facts and the reasons that you just said. Because we're so busy and we're doing this, we're jumping here, we're going there, we're meeting, we're so much going on that like you said, if you really are a sole business person and you're doing it all alone, organization is going to be key. Regardless, if you're not, organization is still essential, right?
Definitely.
However, first step was building that LLC, checking to make sure that no one has your first name, business name.
Oh, my business sense is Infinite Vitality.
How you came up with that name.
Uh, Actually, it was Roger's
So your
idea.
husband influenced in your
Influence,
name.
yes,
I
yes.
thought
So,
it was a great name.
yes,
That's good,
right?
but that shows that you
Yes.
have the support of your
Oh,
husband.
absolutely.
And clearly,
1000%.
to build your brand, you
Yes.
said, you know what, honey, I agree. I like that name.
Yes.
But how did he come up with that name?
We were looking like for something because we want to transition into longevity. We want
Okay.
to go into we don't want to only fix your outside. We also want to fix within yourself. So
Okay.
also we're thinking about I want to make you feel better, like long term, exactly. Anything that is related to longevity and make you live longer and better. That's what we really love, Roger and I. So that's why he say like infinite vitality, like a vitality that will last forever. And then we put in the bottom, we put like health and longevity center.
Okay. I personally love the name. And when you
Oh,
showed
thank
me
you.
all the, you know, all the designs of all your logos and all that, it was like more exciting, right? Because now
Yes,
seeing a visual,
a
putting the
visual.
brand
Mhm.
together and your mission, the mission for
Definitely.
your business brand and how to grow
Yes.
it. I thought it was fantastic. But
Yeah.
that's the second step, right?
Yes,
Well,
that's
actually,
totally.
that's the first
That's
step.
the first step.
Really
Yes.
coming up with the name and then registering it.
Yes. How do you do yours? Your registration.
So I went onto the IRS website,
Mm-hmm.
and I know that I definitely needed help. I do have other friends that are in the business of being a boss, and they kind of walk me through. That's the beauty of being connected, because I'm not the best researcher. I like to do it on certain things, but I
Mm-hmm.
think that something like this, because I was so fearful to do, I'm
Yes.
like, I don't want to mess this up.
And it's the IRS. We don't want to mess it up with the IRS.
Exactly. You don't want
Mm-hmm.
to play around with it.
No.
So I did connect with my two friends, Rosemary and Cece, which I graduated with, which we speak every day, and we're constantly in conversation about our daily lives and experiences. They really helped me out through the process. So I'm really grateful for that. But it was through the IRS, building a business. I obviously had to come up with the name, you register it, and after that, as long as it's not taken, you can take the LLC,
That's good.
right?
How
After
long does
that,
it take?
not long at all. It gives it to you right away. If it's not taken, it gives it to you right away.
Right there.
Yeah, right there. So that part is not an issue. But obviously, that's not the only part. Then you have to go to the bank. You have to open up a business account, right? Because you want to translate your earnings into a business account.
Yes.
I also opened up a business credit card,
Mm-hmm.
right? For education, for meetings, for meetups, whatever the case is, you want to make sure that everything is kind of business related, right? So that
Yes.
was also part of it. But what else? Collaborating
Yes.
physician. That's
That's a big one.
huge.
That is huge. Yes. And that's difficult to find sometimes.
You know what? In the state of New Jersey, we are one of the few states that have to collaborate with a physician that oversee us, right?
Mhm.
So I contact my collaborating physician whenever I need him. If I have any questions, thank God he's very available.
Very
Or
available.
if he can't, he'll text me, give me 5 minutes, or I'll meet you at 12 o'clock,
Mhm.
via text. Or he's very responsive. So imagine you need help, Carmen. You want someone that's responsive. In your case, like I said, you have that support from your family.
Yes. Yes.
Who is your collaborating physician?
My husband.
Your husband,
Yes.
right? Which again, it's such a big partnership, because it's
Yes.
like you guys are in business together
Yes.
and personal together. Let me ask you this. How do you separate that?
We separated very easy, I think.
Okay.
We are great co-workers too. I never thought of it, to be honest with you. Yes.
That's a good question though
That
to
is a
think
good
about,
question. Yeah.
right?
But we're not working together all the time. That's the thing. We are
Okay.
only together 1 day a week.
See, that's not a bad thing. Do
No,
you feel like maybe things would be a little bit more tense if you had to work with him all the time and then go home and be with him?
no, no. I like it. He's very easy. Yeah, he's very simple, easygoing.
I agree
Yeah,
with you. He's
yeah.
very like,
He's very
let's just
chill.
adapt.
Yeah,
Yes, I
adaptable.
totally agree with you. I
Yeah,
think
so
you guys are a perfect balance, to be honest.
definitely.
He levels you out, and
He-
you give him some perspective of life too, which I love. That but that's an interesting concept, right? Like people
Yes,
that work together, business partners with husbands and wives or significant others. In your case, you feel very comfortable to
very
do so.
comfortable. And I'm very comfortable to ask him the stupid questions too. Because sometimes
Do you think because it's your husband that you are not like, is he gonna think that I'm not smart enough or competent enough?
no, actually I'm comfortable asking him the questions. I'm very comfortable.
But
Like
why do you think you're so comfortable to ask him? Is it because he's your husband?
um maybe because he gave me that confidence, like you can come to me for anything and I would not judge.
Okay.
Like this is like a non-judgment son for
I love
us.
that.
So yeah, I can ask him all the stupid questions that I have, and if sometimes he has to explain things to me over and over and over, and he doesn't get tired of explaining. I really like working with him. I think if I was working with another physician, it would not go as well.
Well, that's called partnership,
Yes,
right? You guys are a good partnership, but I think also it becomes more innate and you can be more conversational with Roger
yes,
because he's also your husband, which
yes,
means that you guys have really good communication personally,
yes.
which then goes and falls into the foundation of professionalism.
And we are so passionate. That's the thing too about the practice, and we are really excited to start this new business together. We are really passionate about it. We cannot wait to
I love
start.
that. I really like, even when you told me from the beginning, like you can see how much you want to do this, which requires drive and motivation,
Yes.
knowledge, right? You mentioned something in the beginning that you have to be ingrained and learning and being educated, trainings,
Yes,
right?
a
Because
lot of training. Like, I'm doing like 7 certification now all
yeah,
together. I don't know how I'm doing this at the same time.
but you want to be educated. You want your
Yes.
patients to see, wow, wow,
Yes.
Miss Keishav, you know what? You're the person that I want to refer to and I want to keep coming to.
Yes, definitely. Even for example, for the other part of the practice, like for Roger's side, I want to be able to a little bit of nutrition. I'm not a nutritionist.
Okay.
However,
But you know,
I know the basics and I educate myself on the things that, for example, like there is a lot of dietary restriction for patients with kidney failures. So I need to be educated on those restrictions so that I can educate the patients and educate the patient make right choices. Right choices
absolutely.
leads to better outcomes for the patients.
Absolutely.
So for example, now I bought a program for functional nutrition. So I want to make sure that I am the most educated that I can be for my patients so that they can get better. If I can provide the resources, one thing is that I educate them, and another thing is that I follow it through it the same way. It's
That's
two
very
different
true.
things, but at least I will be able to provide with the best care that you can have.
I love that. I absolutely love that. I'll go back to with my business. I jumped in. However, I did decide to do it as a virtual only as of right now,
As of
right?
right now, yes.
As of right now. I think um when we're talking about finances and starting a business, I know that I have come to you for advice about this and what your thoughts are, right?
Yes.
Because we talk a lot about
Uh,
personal and professional
yes.
issues, right? So
Yes.
I know that you advised me very early on, and so did my husband. Like, honey, this is a great practice. For one, you're helping people. For two, it can
Absolutely.
be lucrative, right? Because there's not
Very.
enough mental health providers.
Yes. And you
And
are bilingual, by the way.
bilingual, and I also treat pediatrics as well as adults,
Yes.
right? So that kind of helps a larger
A
population.
large, yes. You have a lot of
Um,
people that you can see.
absolutely, absolutely. And I decided to do also the harder hours of the weekends.
Hmm.
And I'm also going to be opening up evening times because I'm well aware that people work during the
Yes.
week.
Yes. It's really hard. It's really hard to make an appointment at 9 in the morning on a Tuesday.
So why not give them the opportunity to get help on a weekend? And I start
Yes.
as early as 7 in the morning, right? If
Definitely.
there's a patient that tells me, Dr. Brescia, I could only see you at 6 in the morning, I'm going to say, you know what? If you're going to be consistent and I can help you, let's do it.
Let's do it. Yeah.
Let's do it. Like, I'm willing.
That is the beauty of
Exactly.
telehealth.
So again, it's virtual. I am saving on overhead. I am saving on overhead, but I also have times allocated for business, meaning after 12 o'clock on Sunday, can't see you. It's my family time.
Yes.
It's
You
my
can
family
block,
time.
but you also can block those times.
I do. I,
And you
I only
can,
put myself up to 12.
yes. And another thing is like you don't have to drive, for example, an hour from New Jersey to New York.
Correct.
You are right there.
I'm right there.
You can work from 7 to 11:30 or 7 to 12. And
Absolutely.
then after 12 you say, "Okay, let's go have brunch.
Abs-
Let's go on with our day." But if you have to imagine if you have to have in a physical space, uh,
yes.
and at some point you will have it, but
Yeah.
having a physical space and then you have to finish the office at 12 o'clock and then driving an hour back to New York,
Yeah.
it is a little more complicated, especially in the weekend. There is a lot of traffic going
A
to the
lot of
city.
traffic. I think eventually the goal is to have a storefront, right?
Yes.
Maybe collaborate. We've spoken about possibly
Yes.
collaborating in the future, having like a wellness center.
Yes.
There's so many ideas, but the first step is jumping in,
Jumping
getting
in.
started, getting that fear, right? Because I think one of the biggest things is having that fear that paralyzes you
Hmm.
and that you can't move forward. But I'm like, but I've worked so hard. Why not? I have the knowledge, I have the support, like, and I have the resources. So why not jump in Do you think that you felt the same or
Oh yes. I think everything that you want is gonna be on the other side of fear.
I
Everything
love
that you
that.
want is gonna be on the other side. So you have to jump the broom. Uh, it's really difficult. Again, for me, it took me a little longer because we were gonna start at the same time, but it took
Yeah.
me a little longer because I have other things that I'm dealing with at the same time. But it is nerve wracking to start. Like now I
Yeah.
am talking to like pharmaceuticals, like to get the products and everything. And it's meeting after meeting, and I have to meet
Mm.
with this pharmacy, then this pharmacy, and also I need to find supplies. I also need to find an EMR. It's so much research into it,
Yeah.
and I need to find an EMR that is good for IV, that is also good for weight loss, that is also good for eventually for hormone and peptides and things like that. It's like also how much I'm gonna charge. Like
Yeah.
that is another big question that we ask ourselves. Am I gonna charge too little? Am I gonna charge too much? Am I gonna have
Yeah.
client and people gonna come to me? It's a lot. It's a lot of anxiety that we put to it too.
Carmen, can you speak a little bit on the expenses that you're going to have? Not the actual number, but what expenses are you going to have with starting or really hands on with your business?
Like for example, like let's talk about in genetics here. If you're gonna start an IV practice, or let's talk about an IV practice together with weight loss and hormone therapy. First of
Okay.
all, you need to do your LLC. In my
Okay.
case, I did my LLC through Northwest because, again, like you say, I'm not too knowledgeable about business and how to open business and the IRS and all of that. So I was really scared of me doing something wrong. So I went through that company. They filed for me. Like in 24 hours, everything was done. Then
Perfect.
I got my business account. Then after that, I I have to you need to find a medical director, because in the state of New Jersey, nurse practitioner, we need a medical director. That is one of the largest expense that you will have.
I agree with you.
Also, you need to find for my type of business, I need a space. Some people they
You need a
prefer like
physical
a
space.
physical space. Some people do like mobile IV that you
Okay.
save a little bit on that. However, I don't feel comfortable right now being traveling, especially with my schedule with my sons.
Gotcha.
Um, I prefer just to have like a hours that I can be there, and then I can just finish and I can just go pick up my kids and then go on with my day. You need the EMR. That is another expense. Then after the EMR, you need products. Products are not cheap. And then you need supplies.
Mm.
That's the other larger expense that you're gonna have with this type of business. And then you also need to pay for malpractice insurance, because the
Mm.
malpractice insurance that I have as a regular nurse practitioner is not the same if I want to add IV therapy, hormone therapy, and if I want to add weight loss to it too. So
So
it's
now
a
you
little
have to get like another additional
another
malpractice.
additional malpractice insurance.
Got
So
it.
that is an
Okay.
even larger amount of money, like than what I'm paying now for the year.
Wow.
And then you have to do advertisement. It's a month to month situation that you also
Yeah.
have. It's a large expense too. And also before everything, we need, even though I am a nurse practitioner, you need to go and buy courses to
Mm.
learn,
To educate
to
yourself.
educate yourself up
Up
to
to date.
date, exactly up to date on all of this, and this new trend of peptides and this new trend of weight loss. And also I've been talking with some of the pharmaceuticals that they are great resources for education. So they came to the office and they gave me like a whole education on who can be, for example, for the weight loss medication, who can qualify for this medication,
Mm.
who is not, and how can you get it approved through the insurance, and all of those are little things that you need to create, and also
Absolutely.
create protocols, procedures, like,
And does that cost money for you to
oh
do
yes,
that?
procedures and protocols that cost money, because that's legal documentation that you need.
I
Also you
see.
need contracts, consent, agreement. All of that
Wow.
is expense.
People say, "Wow, Carmen, you're starting your own business. You're making it. You're but look at all the expenses you just
Yes,
mentioned.
before I open anything.
Even before you make anything." Someone was asking me not too long ago. It said the same thing. "Oh, Marisol, but you have your own practice." I'm like, "Do you know how much I have to spend? You don't know." I personally have to pay my collaborating physician,
Yes.
like our own. I pay for an e-scribe, right? An e-scribe online so that I can prescribe medications. I'm on Psychology Today, so that's also an expense. I pay for my advertisement, social media,
Social media,
right?
it's a
I
big
have to
thing.
put money out. In order to do well and put your name out there, you have to invest. And
Yes,
this is a huge investment for me. So I
definitely.
am putting out whatever I can at this point. Hopefully, as I grow my business, I can do different things. But right now, that's part of it.
What about the
Um,
EMR? Do you have to pay for your EMR?
so I pay. So what I do is I use a billing system that's connected to an
I see.
EHR, my documentation system. So they take like a part of the money, a percentage
Mhm.
amount, and then I get a different percent from when I see patients.
I see.
So yes, technically I don't have an exact number on that percent, but the billing system that I use, they take
And they
a
they
percentage
yeah, they
out.
take a percentage and then you can use their EMR.
I can use correct. So
And also you have to pay for insurance, for malpractice insurance
I
as well.
pay malpractice insurance. Absolutely. So all these expenses just to get started, right? Just to get started. So when I do my monthly expenses, I'm like, the I think the biggest part for me right now is the consistency of the patients.
Yes.
One week I'll be seeing let's just say 10 to 15 patients. The next week I can see 10 patients. The following week I can see 4 patients. The next week I can see 1 patient. And I'm
Yes.
like, there is no consistency as you're trying to
Yes.
build. So I can't even say, well, I'm going to profit this amount next month.
Yeah.
You know what I mean?
It's
Because I
not
don't have
guarantee.
consistency yet. I have spoken to a few business um, owners, one of them being my husband, and he told me that it took about 2 years to build his practice.
Yes. It takes a little bit of time,
Your
definitely.
husband and his family have their own practice.
Yes.
How long did it take them? Do you know?
I'm not sure, but it takes a little bit of time. To build like that consistency, it takes you a little bit of time. Absolutely. But you're gonna get there.
I
After,
think we're both very positive
yes.
people, and we
Yes.
feel like we keep reminding ourselves why we started this in the
Exactly.
first place.
Yes.
And I do believe we're going to get there, but I think
I
we're very
think so.
similar with that.
Yes, we're gonna get there,
Yeah.
some way or another. But
Yeah.
also after also you open like maybe like your storefront, you're gonna see more of that consistency.
Yeah.
Because remember, there is a lot of patients that they are not too familiar with the, making an appointment online.
Yeah.
And, maybe they don't have the technology that
Yeah.
requires for you to have an appointment online and everything. Maybe you're gonna get more patients in that way too.
Yeah. I know that even aside of the technology, some people want to see their doctor,
Yes.
right? We can't take that away because that, I think COVID hit that virtual okay. It was accepted. Prior to that, it was like, how can you be a doctor over the computer?
Yes.
COVID opened up doors that we never thought we can actually be a part of, right? So through that huge storm came some really positive outcomes.
Yes.
You know what I mean? I thought virtual was fantastic.
It is fantastic.
Fantastic. But I like to see my doctors in person. So how can eventually I want to get to the, I can use my office in the physical location and stay there doing virtual appointments,
Yeah, absolutely.
just use the space for privacy and confidentiality.
Yes. That's another thing that you, in your type of business, you need a place that is confidential.
Absolutely. Absolutely. Because right now in my office, in my home, no one is allowed in that space when I'm seeing
Of
patients.
course, yes.
No one is allowed. No.
No,
I don't care that you can't see their face. I don't care that you're just running to the my
no.
patients, my time, and this is confidential information.
Yes.
Period. You know what I mean? So
It's
it's been a
very
journey.
sensitive subject.
But can I just speak on this? If you are a provider, and I'm going to speak to the psychiatric world, and then Carmen, maybe you can speak on your world. We are also therapists. As a psychiatric provider, you should 1000% have your own therapist as well.
Absolutely.
there's no reason why I shouldn't have a therapist. All the things that I see, all the things that I hear, all the things that I'm involved in,
Yes,
to release
you need to
1000%.
you need to speak to somebody. You need to have your own support system because you see so much.
Yep.
Like not that long ago, I saw a patient that he was telling me, no, because I need to go to the, how do you call those places where they give food when you go in stand in line and you get food,
Like a
like a pantry. Yeah,
okay,
like a pantry to get
a
food.
food pantry
A food pantry because he would, with the money
or
that he
like a
gets,
soup kitchen, kind of
something
like
like that.
that.
Yes. Because the money that he gets, he would not be able to stretch it for the whole month.
I
You
see.
know, like those kind of things, it hurts to see
Absolutely.
patients and especially
Struggling.
elderly patients struggling. And when sometimes I get these patients that it is, or I eat or I pay for my Farxiga, or I eat or I
Mm,
pay for my Lukelma. Those medications are expensive medication that sometimes insurance doesn't want to cover as much money. For somebody to pay, for example, it's more than that, but somebody to pay $150 for 1 month's supply, it is a lot of money. So this, when
1000%.
you see that, you thank God that, like thank God I don't need that type of medication, and thank God that I am able to work and that I'm able to afford. But there is a lot of patients that cannot afford the medication, and medication is a necessity. It is an absolute necessity.
Absolutely.
So when you see that, it breaks your heart. So you feel kind of down. It doesn't sit well.
So, do you feel that in your world, because exactly what you meant, I thought that was a perfect example of how you are human and how you are also putting your passion and your compassion into your work, but you also have feelings,
Of
right?
course,
Like you
yes.
mentioned, they hurt. It hurts
It
that
hurts.
I know that a patient can't pay their rent. It's either or. Do
Sometimes
you
they have
feel
to
like,
make that decision.
absolutely, do you feel that in your world, a therapist is also important?
Oh, yeah, definitely. Like, it's so sad. Like we see young people, especially young mothers, to go, not, anybody that go through any hardships, of course, you're going to feel bad. But when you see like a young mother with little kids that they have to be placed on dialysis, I put myself in those shoes.
Yeah.
It's not like I'm not more empathetic to the mothers than to any of the patients. I am very empathetic to everybody, but when I see a mother with young kids that they have to be placed on dialysis, it really breaks my heart because that can be me, and I have little kids, and now I'm gonna be depending on going 3 days a week to a center to do dialysis. And imagine life continues. My kids' education,
Absolutely.
like I have to still take care of my kids. I have to still work. I have to still do other things. So imagine how hard it is. Do you need to go to a place for 4 hours? Sometimes, it depends, 4 to 5 hours, let's give and take, every other day. That changes your life. That
Absolutely.
absolutely changes your life forever.
Absolutely. 1000%. I agree with you. I think the other, that can be an expense too. Your insurance, right? What about if you're working for yourself, you have to have your own insurance. And you may have to pay for therapy.
Yes, and it's very
So
expensive to pay for your own insurance, and I don't think it covers as much as, for example, when I used to work at Trinitas, I think the insurance, I would pay less money for copay, and I would pay less money for all of those deductibles that I still don't understand, all of those fees that you have to pay than right now. And
absolutely.
it's a
And
big
so
expense. I
that's a
think that's the
huge
largest.
expense.
That's the
That's a huge, huge, huge expense. But again, it's something that's needed,
It is
right?
needed. Yes.
That's something that's needed. A big part of entrepreneurship, as I mentioned before, is connections, networking. What are you doing to get out there? What are you doing to advertise and really connect with other people to grow your brand?
So in my case, Chica, this podcast, we created it so that I can
Yeah.
be like, let's say real. I am terrified of cameras. This chica is terrified of cameras. So this is one of the reasons why we created this podcast, for me to get my
That's
phobia
true.
desensitized. So whenever I'm ready to do my business portion, I need to advertise and I have to record myself.
That's
So
right.
that is coming. So this is my practice. This is my training, let's say.
This is your training. But I think
Yes.
we're giving vital information that other people can relate for sure.
Because, for example, in our type of field that we are doing, patients want to see the person that is speaking to them. They don't want to see a model. They don't want to see a professional advertiser. They want to see you. Whenever they go to your
Absolutely.
practice, whenever they speak to you on the telehealth, or whenever they go to your storefront office, they want to see you. And in my case too, if they want to see me, They want to see the person that is talking to them through the social media.
Absolutely.
So I think that's gonna be my main thing. I started a TikTok. I don't even know how to use it that much, but that's a
For
learning
sure.
process.
So you're using social media.
Yes,
Okay.
I'm gonna be using social media for advertisement because I think that's the best, cheapest tool that you can. Of course, we still need to spend for to record the videos and to take the pictures. It's a lot. It goes a lot to into that. It's hours. Like we are learning.
Absolutely. 1000%. I ended up getting business cards. Incredible friend Jonathan that lives in California. He does business card creations, and he helped me out so much in getting my logo out. So that's the first thing that I kind of did,
And I
right?
really like your logo too.
But I think it's simple but professional.
It's
So
beautiful.
you sometimes less is more, right?
Yes.
And he actually told me that. He's like, Marisol, I know that you want all this stuff, but less is cleaner. It's easier for the eye, right? So he has that visual.
Yes.
So that was very helpful of having someone that's knowledgeable in that, because I'm like, but it's a business card. Yes, logically, okay, but you want to cover so much information in a little piece of
In a little
paper?
piece of
He's
paper,
like,
yeah.
no, absolutely. He's like, no, we can do a QR code. We can put your contact. They can contact you. But I thought my business card was absolutely beautiful. So I have business cards. I have brochures, which I'm going to be going around to different offices to kind of hand out. Therapists, yeah.
That is a good idea.
Therapist offices, or even therapists that I know, kind of drop them off. I know that you mentioned that I can bring some to your practice
Yes.
as well. My other friend Stephanie, she also said, please give her a few. So I will be doing that to kind of help me get out there, right? But putting myself on like Google, like if you Google, yes, if you Google psychiatrists near me or nurse practitioner near me, at least in the area, I come up.
That's good.
So that also helps me, right? Because what do you do when you want something or directions, something to eat near me? What's the nearest
Yes,
gas
you
station?
Google
Where's
it.
that kind of helps me as well. But again, social media,
You have your own website.
I have my own website, and connecting with physical people. So I have a good friend that he has a med spa, and he knew someone that was looking for a psychiatric nurse practitioner, right? So shout out to Odell, who has an incredible med spa. We're actually going to be interviewing him hopefully sooner than later on our podcast. But he's doing the whole IV drips and really doing weight loss things. And I mean, he has to educate me for sure, but he is killing it in the game. And I'm so proud because he started from the bottom, and he has built such a name for him, and it's just something to be proud of, right?
Definitely.
So he recommended me to a Miss Victoria James, which is an entrepreneur, a CEO, was homeless. Her story is wild.
Wow.
And I hope that we can at some point interview her here, because she is
Absolutely.
phenomenal. She has her own business she does therapy. So it's Evergrow Counseling.
Oh,
So
nice. That's a
my
beautiful
friend
name.
Odell, yeah, my friend Odell connected me to her. She connected me to team up with a patient of hers that needed
Oh,
medication.
that is nice.
So, and that's what I said. I said to my friend Odell, first of all, thank you for thinking about me, because that makes me feel that they think I'm knowledgeable, that I'm
Yes.
competent, that I'm approachable, that I can listen.
Yes. That you are going to be able
Absolutely.
to help.
So now Victoria and I work as a team, and I have said sometimes to her, listen, do you have 5 minutes where I can update you? And she'll reach out to me, listen, this is what happened in session, right? We're teaming up with the permission, obviously, of the patient, because confidentiality. He was completely open and said, please feel free to speak to one another so that you can better help me. But I thought it was beautiful.
It is
That's the
amazing.
beauty of connection.
I
My other
I
two
love
friends,
that.
absolutely. My other two friends that have therapy sessions that at some point I hope to have them on the podcast. I've referred a few of them to to Arbor, which is one of my friend Grace's therapy, and Anna Pais, which serves a lot of the first responders, right? So I just think being connected is so, so important. Because Carmen, I can have someone that says, you know what, I'm looking for a nephrologist. I'm looking for this. I'm
Yes.
looking for an NP. You know what? I have the right person.
Yes.
Carmen, I need you to take care of my patient. And you have told me before, hey, I'm going to refer you to
Yes, absolutely. Yes. Whenever I have the opportunity, I say, I need to refer you, like you need to speak to somebody.
Absolutely.
And I think about it. I text you, I say, Marisol.
Yeah. And so we also have a really incredible partnership,
Definitely.
right? We communicate all the time, personally, professionally. We relate on many, many things. We have a lot of common ground. And I think this is why we work so well. We mesh so well together.
Yes,
You know what I mean?
absolutely.
So, did you want to add anything else regarding the business, entrepreneurship, advice? What about like an advice to someone that is afraid to open up and start their own business? What do you think that you would say?
Get educated and go for it. Get it done. There is space for everybody. I think we are our own competition, and a lot of people say to me, "Oh, but there is like 1,000 people doing IVs." Yes, but I'm gonna be 1,001.
Absolutely. I love that. I actually love that.
I'm gonna be 1,001 because I think, like again, like remember I said, the sun comes out for everybody. It's not just for everyone has their moment, everybody, and there is enough people in this country for everybody to shine at some point.
I would definitely say, like you said, go for it. We don't have a manual. Jump in. It may feel like you may have imposter syndrome,
Yes.
right? Like initially, that fear of, am I good enough to take care of somebody else? But you have the knowledge. We are educated.
We are educated. We went
We
through a
are
lot.
educated. Absolutely. So, what did you say before? What was the quote about fear?
Everything that you want, it goes. Everything that you want in life is gonna be on the other side of fear.
It's going to be on the other side. So, like you mentioned, put all your wants, your needs, desires, motivation, determination, all the years of education, put it into this passion and just go for it.
Yep.
You will be so happy to understand that you put all the hard work in, and now it's the time to shine and help other people.
To help. Exactly. But you put yourself in those shoes. For example, in my case, I'm sometimes tired and I am like, maybe a little bit of IV therapy will help me. So if it can help me, it can help another person. We are moms, we are hardworking people. We deserve a little bit of care.
Absolutely. Absolutely. And I'll finish off this episode with this quote that I'm completely obsessed with and I don't stop hearing. What you don't change, you are choosing. So if you are complaining, why haven't I started my business? Why am I so scared? Why? No, what you're choosing, what you're not changing, you are choosing. So
That's
change that mindset.
Yep.
Change it into a positive light. Understand that we all were there and we were all scared and we're still scared. But we're
Exactly.
knowledgeable.
Very
So we have
knowledgeable.
that to back us up. So go full throttle into your dreams, manifest them. And if you ever need help, connect with other people that have been where you have been. So, Carmen, any last words?
I would say, again, just go for it. We are going to be afraid. We are going to feel that we're not enough or that we're going to feel that we're not knowledgeable enough. But I think we just have to go for it. We just have to, and it doesn't have to be a business in healthcare. It can be, for example, you want your Amazon store or you want your Etsy shop to be there.
Yeah.
Just go for it. Like find the resources. There is so much resources for anything that you dream of. Even sometimes can be, I don't want to do healthcare. I want to do eyebrows. I want to do eyelashes. Go for that course. Buy that course. Do that course. Finish it. Professional. Go for an internship. Ask somebody, can I work for free here until I learn? If you want to do injectables, go and take the course. Go find resources. Like in New York, there is many schools that offer those type of courses if you want to do injectable. There is also international courses that you can take. Not that you're going to be, practicing with an international course, but it's just as a practice. You can go international.
Learning, training.
There is so many things like you can do. Open that online business. If you want to be an influencer, open that TikTok, open that Instagram. Do it. Just
Go
do
for
whatever.
it.
Go for
Go
it.
for it. So, my people, our people of full love and support for our podcast of Cocktail con las Chicas. I hope this was very helpful. If you have any questions, please reach out to us. We will be leaving our Instagram handle so that you guys can ask us questions or DM us. Or if you want to be on our podcast, if you want to promote your own business, please know that we are here to help other people and get the word out. So thank you for listening to this new episode, and we will see you guys very soon.
Bye.
Take care.
Take care.